Should a patient expect from us when he comes to our center for treatment? Now, with respect to our orthopedic cases, I'll be speaking. So, on the very first day, I'll be evaluating and assessing the patient with a deep history and a proper assessment. We follow neurokinetic therapy protocol in our clinic. So, accordingly, his assessment is done, and here we treat the cause which is giving the symptoms. Okay, so when if suppose a patient has come with a neck pain, that lady one day she had come with a neck pain, and her MRI was showing little changes, and she was having excruciating pain which was coming on and off. So when I evaluated, what I found that the C-section scar which is down, that was pulling the fascia in the front. So when that fascia was pulling constantly, her neck and shoulder was in a compromised position. So that was giving her pain on and off. So once I mobilized, like accordingly we will be planning the treatment. So we will be treating the cause which is giving you the symptoms. Okay, now here sometimes patient they are behind me that why won't you apply some electric modalities. So those when patient are in excruciating pain, definitely we go for that. But then when we want to correct the mechanical issue, we have to go for exercises. See what happened when a patient comes to us, they are in a abnormal pattern, dysfunctional pattern which they have developed because of their lifestyle. Okay, some people they sit for longer periods, maximum throughout the day they are sitting. Few of them, like the housewives, they are just standing in the kitchen. So accordingly the few muscles they are recruited more, and the rest of them which has to work, they are not working. Okay, so here we will be balancing the exercises, balancing the muscles through exercises uh, at our center. So what rather we expect from the patient is they have to be little patience with their body. Okay, suppose a patient has come to me with acute pain, so which is very excruciating. So for that acute pain to come, there has to be a consequent days of abnormal sitting, walking, or working periods, which has led to this acute onset of pain. And if a chronic patient has come, so then again those all abnormal patterns are developed in their body. So it is how fast their body accept this change, they will come out of that pain and disability. Okay, so they need to keep little patience, and accordingly the homework exercises are given to them, so they have to do those exercises at home regularly. Their hydration, that is they should have ample amount of water. Okay, a good balanced diet with high protein and vitamin D and D3 and B12 supplements they need to take. So when the body is in a favorable condition to accept the change of exercises which we will be giving, the results will be faster. Okay, so this is the situation when we treat orthopedic cases. Secondly, here we treat maximum patients with manual therapy and with exercises, and our exercises are individually tailored according to the patient's requirement and need and their level of fitness. Okay, so if a 90-year-old person has come to me, so accordingly the exercise plan will be different. And if a sportsman who is just 20 years, so accordingly the exercises plan which we will be taking for him will be different. It won't be the same for everyone. No exercises are given with stickers or a pamphlet of exercises, because each person is different. Maybe they are having the same back pain. Okay, now the functional capacity, when a patient comes to me, a knee pain patient is coming to me with she's on a walker, 65-year-old case. So I will be concentrating on how I can take out the walker and take her on the stick. and gradually how to discard that stick, and she should be able to walk on a plain surface, then on an uneven surface, then how she is able to climb the stairs. So all these, then partial squats, so all these are taken care. So our exercises will be changing according to the changes which are occurring in the patient's body because of exercises. Now many a times what happen is, there after patient is not in a habit of doing exercises, so there are chances that the muscles will have aches and pains. So that is delayed onset muscle soreness. So for that the patient has to keep patience. They have to have a good amount of electrolyte and coconut water, so that that delayed onset muscle soreness, that lactic acid which is being stored in the muscles which were not ready to accept that change, that will come down, and then again we should start with the exercise plan. So they need to be patient, and accordingly, like they have to do the homework at their place. So this is what we expect from the patient. Secondly, many a times what happen is they are deprived of night sleep. Many reasons are there, some emotional disturbances are there. So all these factors will affect their recovery. So if a good amount of sleep of 6 hours, minimum 6 hours, if they are taking, and they are able to manage their emotions, so definitely the recovery period will be fast. Thank you.